About 23% of adults in the United States live with a mental illness. That's about 1 in every 5 adults, according to a 2022 report by the National Institute of Mental Health. And adults are not the only ones who struggle. According to a report by the U.S. Center for Disease Control and Prevention in 2022, about 16% of children have received a diagnosis of mental illness. Thanks for joining us here on News Center Maine Plus. I'm Chris Costa. Those statistics are why we here at News Center Maine find it so important to talk about mental health struggles. Today, we're taking a look at how seasons and holidays can impact mental health, the struggles that children have both in and outside of school, and the struggles many parents face trying to navigate it all. First, winter can be a tough season, especially in Maine. The days feel shorter, it's dark by 4 p.m., and cold, snowy weather makes it difficult for many people to get outside. All of these things can have a major impact on mental health and could lead to seasonal affective disorder. News Center Maine's Katie Delaney shows us how researchers in Maine are finding ways to help.
Here at the Jackson Laboratory in Bar Harbor, researcher Gretchen Clark is studying the circadian rhythm and how disruptions in it can cause conditions like seasonal affective disorder.
So it all has to do with light.
Clark says when the sun goes down earlier in the winter and we get less light, it can disrupt your body's internal clock, which can affect your mood and energy levels.
I mean, we just went through a summer where the sun set at 8:30 p.m. and now the sun sets at 3:30 p.m. That's a huge change for our bodies, and it can be really difficult for us to adapt.
According to Maine Health Behavioral Health, it's normal to feel affected by the change in season, but around 3% of people nationwide have clinical seasonal affective disorder. Dr. Lee Wolfram says that's when symptoms start to affect day-to-day functioning.
If the thoughts ever get towards not wanting to live anymore, not finding reasons to live, or if you're really unable to take care of yourself and you're neglecting the basic things, eating, sleeping.
In those cases, Wolfram says it's important to seek help from a mental health professional.
Find a support group, whether that's professionals or others, family, friends, whomever, and to just not think that you have to go it alone.
For anyone who is experiencing the winter blues, Clark says keeping your routine consistent is key, as well as building good habits like exercising and eating well.
Prioritizing that circadian routine, putting the phone away at night so that you can truly go to sleep in the dark, and making sure when you wake up you get that bright early morning light.
That was Katie Delaney reporting. There's a new clinical definition for major depressive disorder. The new definition takes away a piece of arbitrary criteria and focuses on the intensity of the symptoms rather than how long someone's been experiencing them. Mental health clinicians say the holidays can amplify feelings of anxiety or depression. I asked them about what to look out for and how you can help someone who's struggling. First is the new clinical definition of major depressive disorder. This is the DSM-5-TR. This is the book that defines diagnoses for mental health issues. The new criteria for someone to be diagnosed with depression decreases the amount of time a person must experience symptoms, down from 6 months to just 2 weeks. That's a big deal, according to Amy Barrier, a licensed clinical social worker with Penobscot Community Health Center.
It's now looked at under intensity rather than time period. It's not these arbitrary time frames. It's more who is the person and how are they existing in their body. And that's what's important.
And major depressive disorder is different than seasonal affective disorder, which does not have a diagnosis in the DSM. People experiencing seasonal affective disorder may feel low, but they can still function.
And people with major depression may be able to get up and force themselves to do those things, but it's hard.
Second, the holidays can amplify any current mental health struggles. Barrier says family interactions and financial stress are 2 main reasons. She says it's critical to prioritize your needs, including spending time with people rather than money on gifts.
All of these things that we celebrate are human-made. And so we ultimately can shift time a little bit, and it's okay. And if people want to spend time with us, then they'll make allowances for us. And friends are important too.
So here are some symptoms to look for when it comes to major depressive disorder. Trouble focusing, trouble getting out of bed, trouble doing activities of daily living, such as personal hygiene. And when it comes to getting help, everyone has different needs, but there are some common themes.
check in on them and be there for them. Because a lot of times that's what's missing, is just knowing that somebody is there and caring for them.
Now, winter is not the only season that can have an impact on mental health. In fact, summer can be isolating for some, especially kids who are on a break from school. Counselors say that with so much downtime, some students find themselves struggling mentally during the summer. Many students also lose their routine and some resources that school can provide. With more downtime, students may be spending more time on social media instead of making in-person connections or getting outside. Katie McElwain is a counselor at Rowe Elementary School in Portland. She says if parents notice their child struggling during the summer season, there are steps they can take to help.
Try not to panic, and then the more you can get your kiddo outside doing engaging things. What's a park we haven't been to that you want to explore? So I think really kind of setting some goals and then making them visible and things like that around is really helpful.
McElwain adds that maintaining some form of routine during summer can also help set kids up for success moving forward. Students of all ages can also experience mental health struggles during the school year. Between their class load, preparing for college or trade school, and facing the constant pressures on social media, it can be a lot of stress for young people to manage. So what signs should parents be looking out for, and how can they help? News Center Maine's Samantha York has some answers.
We all remember them, the first day of school jitters. Where's my locker? Where are my classes? Who will sit with me at lunch? You get the picture. Each day, students of all ages are learning who they want to be, who they don't want to be, and how to process the world around them.
There's a lot that they're taking in.
Dana Anderson is the executive director of Valo Maine, a nonprofit with a mission to nurture young people with a sense of belonging, connection, and tools. She says the focus now, more than ever, is to get students talking about mental health.
Let's create a space where it's cool or normal to tell our story, to bravely open up and recognize we're not only doing it for ourselves, but it's a gift to someone else when we dare open up to them and when we inspire them to do the same.
Research from the CDC shows the number of adolescents reporting poor mental health is increasing. In 2021, more than 42% of students felt persistently sad or hopeless, and more than 22% of students seriously considered attempting suicide. Let that sink in.
When I think about this mental health crisis and the causes, I think of the pandemic's isolation, I think of social media and the addiction to phone, I think of the climate crisis and all the other news that they're bombarded with that previous generations, because of not having phones, have not had to deal with.
I typically talk about focusing on 4 categories: moods, thoughts, behaviors, and appearance.
Libby Wright with NAMI Maine says to be on the lookout for the warning signs if you suspect your child is struggling with their mental health. Pay attention to things like poor hygiene and changes in friends groups, their mood or appearance. Look for things that change in their routine.
When, as a parent, is it okay to say, okay, this doesn't seem typical anymore. I need to get my child help right now?
It can be difficult. I think having those ongoing conversations and saying, hey, how are you? Those check-ins and that young person knowing that they can go to you and talk to you is crucial in this. We know our children best, and you get that gut feeling when you know something is off.
Wright and Anderson would agree the greatest tool we have to combat this growing trend is one another. But we have to be willing to have the tough conversations, and more importantly, listen.
So we asked young people, how are you learning about mental health? How do you want to learn about it? And who are the trusted adults in your lives? And quite a few of them from very different schools would say that they felt the adults in their life weren't comfortable having these conversations. And that they felt when they would bring things up about their mental health, maybe they were having an anxious day or they were feeling depressed, that immediately it felt like they needed to go to the mental health counselor or somebody that was more equipped to handle that conversation. And so that was kind of heartbreaking because we all play a piece in the prevention puzzle.
I think it's a little bit of just changing the way we talk with each other and the way we open up and see each other. And so then we have fewer spaces where kids say like, oh, I can't tell anyone, I won't tell anyone this. All any of us really want is a sense of belonging. We want to be seen.
That was Samantha York reporting. When we come back, how to navigate finding mental health care for kids or loved ones who are struggling. Welcome back. School districts in Maine are starting to see more students taking advantage of health clinics in their schools, giving them access to medical, dental, and even mental health care just steps away from their classrooms. South Portland School Superintendent Tim Matheny says between 2022 and 2023 school years, there was a 59% increase of medical visits to clinics within the district. Greater Portland Health served multiple schools in the Portland area, including South Portland. Matheny says health practitioners conducted about 400 mental health visits at the South Portland District schools just last school year. He says having resources in schools is a game changer for both parents and kids.
Absolutely. And when they're healthier, they can learn better when they don't have those obstacles in their way. And I think parents send their kids to our school district hoping they're going to be well cared for.
According to NAMI, 14,000 kids between the ages of 12 and 17 in Maine struggle with depression, and more than 200,000 adults in this state have a mental health condition. That's nearly the entire population of York County. This is why programs that provide affordable mental health care are so important. News Center Maine's Sam Rogers spoke with specialists about ways parents and individuals can help their loved ones find support.
I've been seeing kids and families struggle with how to take care of their own mental health and how to navigate the mental health system.
That's Dr. Christine Crawford, a child psychiatrist and the Associate Medical Director for the National Alliance on Mental Illness.
Yeah, it could be really confusing to figure out where do you start when it comes to getting your kid the help and support that they need.
That's why she wrote this book, a guide to helping parents and caregivers navigate their children's mental health.
So I recommend that folks talk to their pediatrician about any mental health concerns, because a lot of pediatricians are actually well trained in how to provide some basic care.
It's really the wave of adolescent medicine where they want the providers to know how to do a lot of these skills.
Dr. Brock Libby is an adolescent medicine physician for Maine Health. Having difficult conversations with younger patients about their mental health is now a big part of his job.
I think more of them want to talk about how they're doing emotionally than the previous generation before them. And that's really awesome, and that's really great that they want to talk about that. We just need to know how to support them in the best way possible.
When it comes to youth mental health, the thing Libby worries the most for everyone is suicide. Even with patients across Maine having issues finding the right care, there are a lot of positive results in this doctor's office, and there are ways parents can help. Libby recommends that you listen to your kids and don't feel that you need to solve anything, and make sure they have someone they trust, even if it isn't you.
Not necessarily an adult, a trusted human that they can talk to, and they can be real, and they can be open, and they can be vulnerable what they're feeling.
It's also important, Libby says, for kids to track their progress.
Because all too often we put our belief and value system upon the patient, but that's not better for the patient.
Using the tool of curiosity is a way Dr. Crawford says parents can start mental health conversations at home. Like, I noticed you're not interested in hanging out with friends anymore. What's behind that?
You then have an idea as to what steps you could take forward with your kid to get the help and support that they need.
Sometimes that support is a trusted person you can talk to, or a specialist you can meet with, or in the case of the Out of the Darkness walks, finding a community that's there for you.
Many times we go through our life thinking that what we're experiencing, no one else has gone through. So just that opportunity to bring people together to say, you're not alone.
That was Sam Rogers reporting. Many parents struggle with balancing their own mental health and helping their children with theirs. According to a recent survey, 9 out of 10 parents feel judged. And a lot of that judgment centers around working parents. Samantha York sat down with wellness expert Dr. Allison Coffin to talk about the feeling of being judged and how we can help ease that feeling.
So most parents do feel judged, and a judgment, if we think of like what is a judgment is a conclusion made by someone or yourself, or many of us think of a judgment as a punishment. So that's why it feels so bad. And judgments usually come from outside places, or they come from your own internal brain, because you think what other people are saying, but you literally have no idea.
Yep.
You know?
No, you just kind of make it up.
Yes. So when you do feel that judgment, it's a wonderful time to do a little self-reflection. So even if it comes from an outside source, it's usually not about you, it's usually about them. And when it comes from yourself, it's usually about you. The awesome thing about that is that you live with you. So you can put the mirror up to yourself and think, why am I feeling that way? Or why do I feel like I'm not doing a good job as a parent? Or why do I feel like I'm not contributing as much to my family? Or why do I feel like I don't exercise as much as I should? Like all those judgments feel bad. And if you look at yourself and think, how can I remedy this? You know, so if you're thinking, I'm not parenting well, like what's one thing that you can do to be like, I'm killing it? Like, and if it's just like, I play war with my kids once a week, like a card game, you know? That might make you feel good, and that might be enough connection for you. Or if you're feeling like, I'm not contributing enough with my job, well, what is it with your job? Are you happy there? Do you want to make a change? Can you do something individually or within your company that makes you feel a little bit more productive? That's something you can do. And then, of course, with physical health, many of us feel judged on the way we look physically. And when I think about that, I'll speak for myself, it's really just about yourself. You know, if you could move your body and you're healthy and everything's good, like we need to simmer down on like feeling judged about gaining 2 pounds and Thanksgiving. Who cares?
Right.
You know?
Well, and I feel like it can be hard to do that reflecting piece. Because you kind of push it, you know, I don't know. I've tried to reflect on things and I just kind of push it out of my mind because it's like, never mind, I just don't want to deal with it. But you definitely, how can you take steps to work through those reflections and to keep doing it?
Well, I think maybe not every single day, because who wants to think about judgments every single day, but maybe once a week you do a weekly reflection. What are things I felt judged about this week? What are things that I could improve on? What are things that I did awesome at? And when you write that stuff down, and if you write down the judgment piece, just break it into 2 columns. Like, how is this affecting my life? And I feel like it's actually not. Like, who cares?
You
know?
Throw it out the window.
But many of us need to see it written down on paper. What am I actually feeling judged about? Does it matter? And if it does matter, then you get to look at yourself and say, what can I do about this? Can I maybe meditate a little bit more? Can I breathe before I get out of the car so I don't have a grumpy face? Like, all those things.
If you're parenting and you're constantly feeling these judgments, how is that going to impact you as a parent with your children?
You're not going to be present because you're going to think about what you're being judged on. So we only have our kids for a very short period of time, and I'm not saying that parenting is easy because it's really hard. But being present with your kids when you have them there is the time that they're going to remember in their lives. They won't remember like the teeny tiny nuances of like making them lunch and things, but they will remember that you like did that thing with them, or you showed up to their event, or you were at their chorus concert. They remember those things because those are the times that you're present in their life when it matters.
One thing that I've started doing is basically telling myself that there's already so many other people out there that are doing the judging. I'm not going to do it. Like, I'm going to be my own friend, you know? That way.
I love that so much. Be your own friend. Be your best friend. Like, I'm awesome at this.
Samantha York reporting. If you or someone you know is struggling with mental health, there are resources available. NAMI Maine has a teen text line. Teens can text the word friend to 62640 to be connected with a specialist trained to provide resources, information, and support. And Maine also has a crisis line anybody can call or text. That number is 1-888-568-1112. It is staffed 24/7 with trained professionals. Thanks so much for watching News Center Maine Plus. Remember to check back here frequently to keep up with our latest projects and stories. Take care.